Good morning, dear BCMCH family. Welcome to one more edition of our quest. Before we start our proceedings, as it is always, may I request our Reverend Father Thomas Varghese Achin, our hospital chaplain, to start with a word of prayer.
In the name of the Father, Son, and the Holy Spirit. Amen. Gracious Heavenly Father, we thank you so much for yet another Thursday in our life, the fourth Thursday of 2024. We have been blessed because of this Thursday many times. Again, we want to hear something new. We want to take the challenge, whatever we hear. We pray for Dr. Thomas Mathew as he's going to speak to us, Lord. Be with him, encourage him, equip him so that the challenges ahead of us, that we'll be able to understand it. We thank you for answering our prayers. In Jesus' mighty name we pray. Amen. Please be seated.
Before we invite our speaker for the day for the talk, we have a very important revealing to make. The speaker has already started off big, and that is what is going to be revealed. And Parkinson's disease patient's handbook, something which is essential for each of the diseases for the patient, especially for chronic diseases. It is starting with Parkinson's disease. So they have come up with a handbook, and to release that, may I invite our beloved director, George Chandy sir, to come forward, and also Head of Neurology, John K. John sir, to come forward. John K. John sir will hand over the new handbook to George Chandy sir as he unveils it. Thank you, sir. Just before Christmas, we were invited to the Christmas celebration of the PMR department. We were all there, and we listened to a wonderful presentation. So taken by that, we immediately requested for a quest, and here you are at that session. So someone who has been a very successful medical entrepreneur in the United States, passionately took up medicine and then conquered that as well, and has been through exciting paths. We have heard from him before. So he presented the plan for the year 2024, and it was wonderful. So we thought that the whole of BCMCH should listen to it, and more of it. So can we all put our hands together and welcome Dr. Thomas Mathew, consultant of PMR BCMCH.
Good morning, everybody. Thank you very much, Dr. Jacob, for that beautiful introduction. We'll go ahead and start. And I've taken this topic as Mission Impossible, because Tom Cruise has done already up to 8. I thought I will do the 9. So he might not have a problem with me. So I hope. So this is Mission Impossible 9 we are going to present. We'll have a short video, then I'll go into the presentation. Video, please.
Our lives sum of our choices. And we cannot escape the past. Ethan, this mission of yours is gonna cost you dearly.
The world is changing. Truth is vanishing. War is coming.
It's been a long time, friend. No idea the power I represent. It knows your story and how it ends.
Listen to me. The world's coming after you.
His fate is written. Shall we write yours too?
If anything happens to them, there's no place that I won't go to kill you. That is written.
Ethan, what's your objective? What's your ultimate objective?
Your life will always matter more to me than my own.
None of our lives can matter more than this mission.
I don't accept that.
Thank you very much. I have nothing to do with the production, but it encourages me whenever I watch it. It's November 2019. Dr. George Chandni sir called me to his office and made some of the statement. So he told me, the mission is yours. Instead of Ethan, he told me, Tommy, this mission is yours. I looked at his face like this, the same expression Tom Cruise gave. And from that, my journey started for the Mission Impossible. The reason sir told me is that he told PMR we have to perform better. At that point, I'll tell the past, we were about 5 to 7 staff physios, no OT, no speech, 2 PMR doctors, and the revenue was 49 lakhs in loss per year. That's the time he brought me and told that CMC PMR is making close to 2 crore per month. Why can't we make it? And they have so many services, why can't we do it? Then he looked at, this is your mission. I told, no sir, I have to think about it. I have a lot my plate full. He told, no. Then you know his usual thing, he gave me a hug and a smile. I told, okay sir, when is the interview? He told me, interview is done, you are appointed, you start tomorrow. That was my appointment went up. So I took up this mission, and the reason I took up is, another one always inspired me is John F. Kennedy. In the Apollo moon mission, he had made this beautiful statement. We choose to go to the moon in this decade itself and do other things, not because they are easy, but because they are hard. Because the goal will serve to organize and measure the best of our energies and skills. Because that the challenges is the one we are willing to accept, one we are unwilling to postpone, and one we intend to win, and the others too. Always inspire me, this John F. Kennedy statement. So I willingly accepted that mission Sir has put on me. But I felt I was in Bethlehem for the first 3 months. I went to my department. There was no chair to sit for me. There was no room for me. So I went to Sir and asked, Sir, I have no room like Christ was born. He gave me a space in the MS office. So my office started in the MS office for 3 months. Then I was relocated back to the PMR department to start my work with. So the mainly we were looking at that point is not our past. What is the possibilities and potentials we have? So I'm going to go over a few activities we have done where we felt our energies were spent instead of spending in egos and interpersonal collapses. We have focused all our energies into different programs and looking at empowering our staff and exciting them, giving them the ownership. So this is one of the things we started in November 2019. And excitingly, I've been here 4 years and 3 months. It shocked me also. Anyway, it was very nice. Yesterday, I was checking my appointment letter to make sure that how long I've been here. So we have started this second month I joined. We had every staff, we have a morning devotion, we get together. There's a staff assigned for that. They will do prayer, song, and a small thought of the day and a reading Bible. And after that, we will have a 15 minutes of clinical presentation by one of the staff or one of the interns will present it. This was one way to start the day with a prayer, and the second technique was to make sure everybody come on time, because it was very obvious who don't come on time. So this has been working beautifully for us. Only concern is Achan has presented that we are not coming to the chapel, but this is the reason. The second thing, we'll go quickly to the different programs we organized. We felt it has helped our department. Second thing is called Blanket of Love. We started this in July 4th, 2022. We have 5 collection points. We collect old clothes, used clothes, minimally used clothes, collect it in the points, bring it to our department, and then take to central laundry and wash it, press it, and we pack them with our children in the CDC in different covers. And then we place it in our lobby for the poor people to take, and also extra things we take to the focal points in different tribal areas and community outreaches. So, and also we have sent some to Bihar outside Kerala for a flood relief time for this Blanket of Love program. Child Development Center is CDC at Aishalem, been inaugurated on August 9, 2022. It's a team of occupational therapists, speech therapists, physiotherapists, development therapists, speech special educators, and psychologists consult and treat patients. This is in association with pediatric department, so we have senior pediatrician and developmental pediatrician to visit weekly. Dr. MKC Nair, former KUHAS VZ, is our mentor for the program, and since then it's been very successfully helping and serving about 30 patients, 30 children daily. We have a community outreach program. This is once a month. We visit different facilities. One is the Navajiva Kendra De-Addiction Center at Malayalapuda. Our psychologists visit there on a voluntary basis and help and train the staff there. And also from our department, we go to Gramajodi CDC in Trivandrum, the Attingara Trivandrum. Our occupational therapists and speech therapists involved with this activity. This is once a month voluntary program we are doing from our department, usually on Saturdays. Agreement with Pradiksha prosthetic and orthotic we have an orthotist coming here every Mondays and Wednesdays having orthotic clinics in PMR, so patients are able to get different type of diabetic footwear, offloading things, splints and braces and prostheses needed. We have an MOU with Otterbock, Germany, and they've been functioning with us since 2022 June. And this is on the 5th floor. On the orthopedic floor, we have an office for them. They are also here on Mondays. This is a high-end technology, the top in India. So we have provided our patient one of the best in India, but this is costly. So we have also provided the Pradesha, which is much more economic to the patient. So we are trying to cater the people in all economic areas there. MOU we have signed with Arden Home Health since July 2, 2021. So far we have serviced about 376 patients discharged from here on home health care. And this program is still continuing. We are going to scale up to medical cab. That means anybody needs an emergency cab, they can call. We are associating with them in lab services and pharmacy services. This is a plan, and also home care services right now. We have MOU initiated with APD Bangalore. It's Association of Persons with Disability. They make specialized wheelchair and community-based thing. We have already received several wheelchairs pretty much free of cost for them, for our IP patients. And we have taken one of our patients from here all the way to the Bangalore with the blessing of the hospital and the administration, made a special wheelchair for her. And first time ever, this girl was able to sit up in a chair dignity-wise. She was in the 9th grade and they used to carry her. This is a muscular dystrophy patient, carry her and put it on the floor of the classroom all these years, and she was first in the class yet. So we provided her electric wheelchair, but unfortunately she couldn't sit in that because there was no trunk muscle. So our PMR manager, Mr. Biju, and mother, and we got our hospital ambulance on hospital expense. We took her to Bangalore, about a 1 week of stay in Bangalore in APD. They modified the chair, make fit for that. And she's so proud that she attends the classes, she goes to social function in electric wheelchair in sitting position now. So we are proud of her, very proud about that. So we decided to have an association with her. We are trying to bring one of your office in Believers here, so that way we can do a lot more service to the community. It's still in works. Hopefully in a month or two it will be finalized. Dyslexia awareness and early identification training. We go to the nearby schools, our team, and do the training how to do early identification in children with difficulty in learning and other milestone delays. We already done in our Believer School and Choice School in Tiruvalla. Wheelchair Warrior Club, this is one of our flagship program we initiated in December 2022. We have a special program for people who was in wheelchair dependent, and we have about 70 members in the club. These people will get special benefit. Their admission at Believers Hospital is completely free. All services are free. They get 1,500 lab free. They get 10,000 rupees of radiology free and 50% charge discount in all therapies. All admission, no bed charges, no consultation fee, and all operations are completely free. So this is an amazing program, and many of the wheelchair-bound patients with severe wound and other problems have been highly benefited. And this is a program in a huge WhatsApp group. We have all around the world been known and called and appreciated about it. So we're still continuing. I really appreciate the management, especially Jamsi sir and George Chandy sir and Achan, for they're gracious enough to approve this program, and it's continuing with us. We have 70 members in it, and we are hoping to scale up to 200 members by end of this year. Community integration program, we have undertaken various projects in the community. We have built a house in Chittar, our department involved, and for a patient who was admitted here called, I forgot his name, Sunil has been admitted, and he is doing very well. And we also did a vocational program training, so he has a small shop and he raised chicken and also umbrella making. We have trained him, so he's become almost, so he's in Chittar area. So with that inspiration, we have taken the second project now. We are building for another spinal cord injury near Kuriannur, a patient called Das. He's below waist T7 spinal cord injury, completely in the bed. He's a fisherman. So we taken up the project of building a house for him now. The ground we got it. Now we are working on that. And also we provide wheelchair accessible ramps and also air mattress at home and different utensils. For Sunil, all the utensils for his house was gathered and collected by the PMR staff itself. Department annual staff review, the new things we started this 2023. It was conducted at Dhyanadhiram in Kollam. It's a beautiful island. And our director, sir, missions director, Father Daniel Johnson, nursing director, and Anant Mani, and about 30 staff participate. This was a 2-day program. This is primarily to empower, train, and encourage our staff. As a staff retreat we initiated, we are hoping to conduct this annually now. We also have monthly department meetings where we discuss all our projects and programs and also discuss the revenue of the previous months, the good, the bad, the minuses, where we can improve. The idea is that the staff need to be empowered. Staff need to take the ownership. So this is what we are doing monthly. We do it in the evening, and we do provide some snacks and food for that meeting, and some casual talks are there. We allow the staff to reciprocate to us what their feelings are, what their visions are, what their challenges are. And that's been going once a month as a staff meeting, and once a year we conduct an annual staff retreat. We publish newspaper articles, and All India Radio, we had multiple sessions. So as a community awareness program propaganda, initiated in 2021 on vital stimulation, pain management, healthy living, and CDD, childhood disintegrative disorder. We have multiple AAR thing and newspaper publications done. Crafts and daycare program. We have a crafts workshop started in 2021 at CDC. We get the children and the parents who bring the children to do a craft workshops, and these crafts are exhibited in our friend lobby, and whatever the sale proceeds, we'll give it back. And also now we have started with Dr. Renji's surgeon's initiative that the crafts they're making, we are giving in our discharge packet. When a happy discharge happens, we give so many of these crafts there, and the hospital is paying us, I think, about 100 rupees per kit, and that money we are using back for the children benefit and buying the stuff for the crafts. We also hired, HR has blessed us with that, with a skilled craft teacher. Really appreciate and thank you for that. Now the whole program is scaled up. The craft teacher trains the children, the parents, and the staff. So it is really going very well now. So we're hoping that about 100 packages of gifts we can make a day. So that will be assigned to the hospital for happy discharges. The internal and internal marketing. We believe in external market, we talk about it. Then we felt that first we have to start with our own people. We did internal marketing. So we made a flyer ourselves, and our social worker will go weekly to every doctor, and there is a stand put on your table, and they will refill the stand and put a complimentary pen also, a couple of pens there also. We always found the pens are fully utilized, but the flyers are partially utilized. So on your table, every week we fill, and this will tell you every service PMR can offer. So a lot of time doctors say, we didn't know that was there. So if you take the PMR flyer, every service we offer is written there. You can send, tick on the flyer and send that to the patient to PMR. And also our home health flyer is there, and our Autobox flyer is there, and our CDC flyer is there. CDC program is called Snehadram is the CDC program. Dialysis patient transport, we want to work almost every department, collaborate and work as interdisciplinary. I think most of the departments we have some connection, relation, support or association with. This program we have started with the nephrology department because a lot of young patients who do dialysis feel like they're wasted, they have nothing to do, and they go home and get depressed. So this program was a brainchild of Dr. Rajesh, Dr. Arun and Dr. Gio. They have talked to us and we have developed it. And what we do is that those patients who are dialysis willing to do, we do a questionnaire, and they're willing to do certain things, we pretty much give them a voluntary work. In contrary, we offer them, if it's a cluster group, we will pick them up for dialysis and we'll give 50% discount for the dialysis process. And we had 2 patients fully benefited, and this is an ongoing program. We utilize them in the reception, usher, and also some of the billing and filing system, something they can handle it. So this is, we are continuing program. So any of your patient dialysis can benefit, please direct that to us. We have different promotional videos. We have put multiple patient videos, success stories. We have made promotional videos, and with their consent, it has been in the public forum right now. PMR orientation manual. One of the things we felt like, even though hospital has an orientation manual program, so many times each department has its own specification. So we made our own PMR orientation manual, and we tell the new staff to spend 1 full day or 2 days reading that manual, understanding it, what's the hospital policies, what is the department policy, make them to sign it. So suddenly they do, I didn't know about it, you didn't tell me. So it's a written proof, they sign it. We're planning to have a pre and post test after this. Only if they pass the test, they'll be put on the floor for working. That is the plan. So it's a quality assurance program part of it. We have done different outcome scales and key performance indicators, that is KPI, clinical and non-clinical. We continue to work with a statistician trying to use this as a tool to improve the quality of the program. We have feedback from some of the patients and the bystanders also we take feedback from. All the feedback from are reviewed by us and needed modifications done. NIBH training is an ongoing process since 2019. We do regular mock drills, quizzes, and incentive for the staff, so they all are still up to date and ongoing. Development of new ortho protocols, we have developed protocols with ortho departments, so that's what they use in the flow. Cardiac rehab program, this is another great program, we almost starting now, in consultation with the cardiac surgery and cardiology department, and we use a group called Vapor Chips. They have wireless ECG monitors, so we're using that. It's almost the training completed, protocol developed. Now, in 1 or 2 months, we'll be initiating the cardiac rehab phase 1, 2, and 3 programs. Head up tilt table test, HUT test. I think a lot of doctors probably doesn't know we have this. We already done cases on this. This is along with the cardiology department, those who have syncope episodes. We are trying to identify whether they are cardiogenic or neurogenic. So we are using this, and right now we are using in the CCC this testing with our tilt table and a trained staff. Yearly Disability Day we celebrate every year. It's ongoing. Next is scheduled for 16th of February 2024, and we are expecting Mr. Muralidharan, MP, our central minister, to attend for the program. So we are expecting about 250 people in wheelchair to come for the day, and we have about 26 electric wheelchair ready to be distributed on that day. Parkinson's workshop and handouts. We have done special clinics in Parkinson's disease along with the neurology and psychiatric department. And today we have published our first handbook for the Parkinson's patient to be given to the patient, so they will know what to do and what not to do, and also as a supplement for what we do for these patients. Musical instruments, our morning worship usually we were like to do with some musical instruments. So staff together put collections and bought a keyboard for our department. So we didn't ask this to the administration to give us, but staff, everybody pitched in and we bought a keyboard for the department now. Tribal Medical Camp is an association with Marthoma Church called CARD program, and we are conducting once a month medical camps from our department primarily to Attathoda, Plapalli, Muriyar, and Manjathoda tribal colonies. We do it in a rotation base along with the community medicine. Dr. Sneha Sangeeta been a great inspiration for us on that, supporting us, and also with the medicine department and pediatric department, because a lot of this need is pediatric, so we've been associated with the pediatric department. So we have done 6 medical camps so far. Once a month, a Saturday, a team from PMR, community medicine, and promotions and pediatrics goes to these areas and service them. Most of the time we go to their huts, and if you really want to know what poverty is, what deprivation is, what underprivilege is, please come a trip with us. It's about 50 miles from here, not anywhere from civilization. People still live in probably in 18th century. Their houses are just covered with parambu-like thing, and roof is completely leaking, thatch. There is no electricity, there is no running water, the floors are not done. 5 or 6 children, and all children looks very malnutritious and diseased, and very sad. About 130 families live in these tribal areas. Gone to the collector multiple times on this, they told they cannot do anything. Only thing they allowed is do medical, give some clothes, might be put a tarpaulin for their roof so they won't leak. We had done about 26 houses. In this same trip, we had done tarpaulin for that. One of my patients here heard about it, asked me about it, and came and gave me 50,000 rupees to do tarpaulin for these patients. So with that money, we have, before this big rain, we have given 26 families tarpaulin. We use our interns, staff came for that. I think it was a life-changing experience for most of them. One of the intern came for that. He was so convinced he's joined back in our department as a staff now. So these are something we are trying to teach our staff, that just routine work is not enough. You have to know where people live, what reality, and the humanity we are trying to create in them. So this is our humanitarian project. Inpatient admissions, we have initiated in January 20. Till then, we do not had inpatient admissions. We have started in January 2021. Now we provide comprehensive rehabilitation as PMR, physiotherapy, occupational therapy, speech, and social work and psychology services for these patients for stroke, head injury, myofascial pain, spinal cord injury, polytrauma, GBS, Parkinson's, and debility. On average, 10 to 14 patients we have in our inpatient department. Most of patients in the ward level are admitted at the ortho ward. Home visit. After inpatient visit, the team goes to their home before discharge and assess their home. We want to make sure when we discharge them, their wheelchair can enter their house. They can able to use the toilet. So they go to their patient's home, do a pre-assessment before discharge, and recommend modifications, and lot of time the staff itself is supporting the modification if they have a financial need is there. So every discharge is done, and we are planning in the future, every month the social worker will go and visit this patient. Are they surviving? Are they maintaining and existence with what we taught them also? So these all are giving a lot of community exposure for us. People are knowing it, people are understanding that it's not just admission we care beyond that. We go out of the way, thinking out of the box, that we really care. And also, I feel that our staff has become more empathetic since then. They are understanding what it means by rehabilitation. Interventional pain clinic, we have started, initiated with anesthesia department. Dr. Leno was coming to us, and now some of the pain management we are doing in anesthesia department itself. Geriatric care, Dr. Lydia has joined with us on this geriatric care programs. So we do a lot of fall risk analysis and prevention strategies for that. Diabetic foot education, we associate with endocrine department, and we used to go there and take classes as a group for a diabetic patient about foot care, general strengthening exercises. Since COVID has been hold, we have started the podiatric nurse program with the podiatric foot care. We have been part of that with the nursing department and endocrinology department. IRAS program is another flagship program of us. It's called Enhanced Recovery After Surgery. It's an international protocol program we are following. We are doing this since June 2022. We have about 35 patients we have completed the IRAS program. The main department coordinate with us is the gastrosurgery department. Possibly every gastrosurgery patients, before their surgery, about 2 to 3 weeks, they were sent to PMR for conditioning and stabilization. We found that those who have gone through IRAS program, their ICU stay post-surgery is reduced significantly, and till now, by God's grace, we don't even have a single fatality involved. These are very significant, including, you remember Justin, we had done 240 kilo surgery we had done and successfully came out. And he has done about 5 weeks of inpatient PMR IRAS conditioning program before he was ready for the surgery. So this is an ongoing program. We are hoping once other departments see the success, the outcome, other departments also before surgery you will send to us for a prehabilitation. So maximum outcome, less complication, less cost for the patient. Economically they benefit because reducing ICU days, definitely complications will come. Takes a little bit convince the patient and the family, but leave that to us. We can do it if you refer to us. Weight management and wellness program, we do not call it weight reduction program. We found that we cannot do that. But we do weight management program and wellness program. So we use our existing gym equipments. It's usually a 30-day program. We have a package for that. We have several patients coming. Before even they think about any bariatric surgery, they're coming and trying this for 30 days. And this is a daily program. There will be a therapist assigned to them. We follow very scientific protocols how to scale up on exercises. They all will also get counseling and dietary consultation also with them. Incontinence rehab program, we do treat urinary incontinence primarily and some fecal incontinence also, but primarily urinary and primarily in female. And this we started in 2021 November. So we have different types of pelvic examinations to understand what is the causing the incontinence, and also bladder, diarrhea, Kegel's ball, pelvic floor exercises, and we have in 2024 we are proposing to buy a biofeedback machine which will in advance will help more in pelvic floor. We have very good success with this. A lot of people, patients who was years and years by incontinent, embarrassed, not able to come to the community, able to control the urine and able to improve the pelvic floor and improve their disease process. Urology coordinate with us a lot on this, and we are working with urology on that. Women's health, gynecology department work this, gynecology and obstetric. Pre and postnatal examination we do in the wards and in the rooms, and also we do exercises and education for these patients who in the pre and postnatal situation. We have vestibular rehab. We have started with we associate with the ENT department on that. We, for different syncope, BP, PV and other balance impairment, we do Dick Halpeck maneuver, Epley's maneuver in the department, also different Frengel's exercise, vestibular exercise. We are going to scale up this. We are getting an international trainer on this from Australia, and he is going to train us on advanced on this. We are trying to look into purchasing the balance board, the higher balancing system. So this is an area very much needed in this middle, and no hospitals anywhere close by has a vestibular program. So we are going to planning to scale up 2024 on this. Research papers, we have published different research papers. Now a lot of research papers are in the line on data collection done, analysis phase and publishing phase. Joshia is involved with community medicine on ICMR project. In the community, it's a 2-year-long project. Dr. Roshan, Ms. Alina, Ms. Ann, all involved in various ICMR projects, and it's ongoing. Electric wheelchair donation, this was started with one wheelchair in 2021 with a very emotional, so you all have probably seen the videos, emotional thing with ANSA Mall, we started this, and now it's become a movement. Amazing how it evolved. In 2022, we give 15 electric wheelchairs. 2023 we gave 11 electric wheelchairs. 2024 we already given last month 5 electric wheelchair, and this coming next month or coming months in the disability day we'll giving 26 more electric wheelchair already been selected, and wheelchairs are ready. Public awareness classes we do with the nursing department, different public awareness classes in the hospital lobby, and also we take classes for nurses and other healthcare professionals. World Therapy Day celebration, we initiated in October 2023. These are different awareness meeting and social write-ups about awareness and then also policy changes. We involved and actively advocate certain policy changes which are related to the profession. COVID special care team, this was initiated in 2021 when the COVID peak was there. I think this, I have to greatly salute Dr. Jomsi, George Chandy sir and others for this, because this was the only hospital done the service. Each and every patient admitted here with COVID infection, a physiotherapist visited them, assessed them, saw them every day. You have to think, with gowns, with masks, with all the gadgets, they have done it. So we feel very proud and happy about this, that not even a single patient here COVID felt like they are left out, they are bored, they are lonely, nobody is cared for. Every day a physiotherapist went there, pat on their back, talked to them, make them walk, get up, saw what they needed and took care of the needs. Really appreciate my colleagues from the bottom of my heart, that very proud for you. And they are not fear about infection or anything. There was a team worked completely for the COVID patient for years together. So we're still continuing it. We have a skeleton team right now. So any COVID patient comes, still they will be seen by a therapist. This is our story. Thank you very much. Thank you. And future, we are planning to make our center PMR as a center of excellence. That's our plan. We want to be, our gold standard is CMC Vellore, nothing less than that. So we want to get to the par where we have more admissions in the inpatients, more outpatients. We have more specialized program. Right now we have about 35 staff. From 7 staff, we have grown in few years to 35 staff. From 49 lakhs loss every year, we have gone to 35 to 40 lakhs revenue every month. That is where we are right now. And I think we didn't focus in revenue. We focused in programs, and we focused in our most valuable asset in the department, which is our human resources. And this 2024, we are committed for our staff. We are trying to, we already done an international seminar, London shoulder training. We are bringing trainers here and training them as a group. So we want to be par with the international standards. So this year our focus is human resources. We are developing human resources, different program, different trainings for them. And this year we already got approved to start physiotherapy bachelor's program, occupational therapy bachelor's program, and speech therapy program. Hopefully we'll start in June. We are also working with Autonomous University for the DPT program. The initial works are started. That is Doctor in Physiotherapy program, 6 years program we are starting. We're also working with international universities to start the exchange program. So the coming years are exciting. Thank you all for all your support, and thanks for the great opportunity to share this proud moments to everybody. Thank you very much. Thank you.
Thank you, dear Thomas, sir, for that brilliant exposition of your plans and all that you've done throughout the years. Can we give a big round of applause for the PMR team for their wonderful work that they do? Any questions? I'm very sure that as different teams, we can take a leaf out of the PMR book and make 2024 extremely successful, enterprising, and entrepreneurial for the institution. Thank you so much. Today is a special day for 2 people. One is Dr. Stephen Panos from General Surgery, and one is Dr. Shana from Anatomy. So we wish them a very, very, very happy birthday and a wonderful new year ahead. Can we all say happy birthday to both of them and give them a big hand? So thank you all for coming. And as I said, it was inspiration guaranteed. I'm sure that you go back inspired and employ a few of these visionary ideas for your department as well as I have imbibed too. Thank you so much. Have a wonderful day. God bless you. Today we have the Kuhas inspection. The inspectors have come